Hi, good afternoon. My name is Dr. Chetan Ginigeri. I'm a pediatric intensivist at Aster CMI Hospital, Bangalore, and I deal with children with extremely serious illnesses, be it medical issues like dengue, multi-organ dysfunction, organ failures, shock, pneumonia, or some complex work like which includes liver transplants, cardiac surgeries, complex pediatric surgeries as such. Over the last 15 years of our work and experience in pediatric intensive care, what we have noticed is that there is a sudden increase in the incidence of childhood unintentional injuries. Now, these are injuries which happen to normal children, specifically between the age of, say, 1 to 5 years, as soon as the child becomes mobile, and then goes on to involve children less than 6 to 8 years as such. And this is primarily because of children being extremely curious about their immediate surroundings. And as adults, we have not yet baby-proofed their immediate environment. The kind of injuries we see most commonly are falls from high-rise buildings. It can be a fall from a balcony of first floor or second floor. It can be a drowning within a bucket, and simple electrocution because the child has put his finger into the electric socket. Can be poisonings, especially dangerous poisonings like toilet cleaners, mosquito repellents, to children having consumed medicines of their parents or grandparents lying unattended in an accessible place. So these are unintentional injuries which, once it happens, leaves a scar both mentally, physically, and emotionally on the child, but also among the immediate family, parents, grandparents. There is a lot of guilt involved. There is a lot of trauma and tragedy involved with these problems. And if we thought the magnitude of problem is not so important, that we don't need to create so much awareness in this primarily common sense, then the research data shows what research data shows is absolutely shocking. World over, one normal child dies every single minute because of an injury-related problem. No other disease in mankind is killing as many normal children as much as unintentional injuries in current world. In the city of Bangalore, when we did a survey in year 2001 with NIMHANS and WHO Surveillance Committee for Injury Prevalence, we found that in a big metro like Bangalore, one child dies on an average every single day because of an injury-related problem. And every 15 minutes, a child seeks medical attention for an injury-related problem. And for every child who seeks medical attention, there are 5 other children who are primarily getting first aid in either their schools or homes. And that's the kind of magnitude we are talking about. So unintentional injury in children is definitely a serious problem. It is reached a public health proportion which we need to address, not by treating these accidents, but by trying and preventing them. And in that regard, we as pediatric intensivists who are witness to these accidents on day-to-day basis, thought we will reach out to the community. Our work has been spanned over a period of around 7 to 10 years, where we do conduct parenting workshops with safety as primary focus. But situation on the ground is not changed much. And with that regard, we brought out a book called Playful, which is primarily addressed to anyone who takes care of children, be it parents, be it grandparents, be it school teachers, IMers in the play school and kindergarten, bus drivers and cleaners who transport these children to and from the school. So anybody who has access to children and childhood play areas needs to know about child safety as such. It is not a new concept. It is just that we have still not valued the lives of our children as much. In the West, every school, every apartment complex, every amusement park is certified child safe. Every mode of transport is certified child safe. Back in India, we do not have that kind of seriousness when it comes to child safety. So we always tell parents that children depend on us for 3 L's. One is love, laughter, and learning. But then today we want to add S to that, and that S is primarily safety. We just want you as parents and people associated with children to just fine tune your sixth sense to the possibility of safety and create an environment, physical environment where children are safe. And that concept, we call it as passive supervision. So young parents, if they know that the room that next to their bedroom is kind of baby proof, there is nothing harmful, nothing dangerous, then they can relax if the child is in that room playing for long periods of time. So that's the concept we want to bring about, and book is just a beginning of that. So now, why do children fall prey to childhood accidents? To understand that, we will have to know about the physical, the psychological, and the mental aspects of children as such. Just to give an example, in the first, say, 1 year of life in the infancy, we have three main problems, physical or psychological attributes, which children can put themselves at risk for. One is that the head size of infants is very large. If you see, my head size will be 1/10 of my total length, but for a child of 1 year, it will be 1/3 or 1/4. What it means is children are extremely top heavy. Now, when they are top heavy, they also become very toppleable. That means the moment they are peeking down from, say, a high-rise chair or table or even a balcony, they will topple. And children, when they fall down in this age group, the head will hit the ground first, no matter what. So without exception, the head will hit the ground first, and they are at risk of serious head injuries. The second problem we see in infancy is primarily that they mount everything. Whatever they get in their hands, they mount everything, be it a crawling worm on the floor, or be it a button battery, or any sharp object which we cannot see so close to the ground. They will pick it up and mount it. Third thing is they have very weak legs. They cannot wriggle out of danger. And once children cross this age of infancy, then they reach, they're more mobile, they get access to places where we cannot go. They are extremely curious, but at the same time, they're extremely fearless. So what it does is put children at risk when in this age, when they are like little scientists. They want to explore everything. They just want to touch, feel, taste, smell everything that's there in their immediate surroundings. And if there are dangerous things lying around in the house, or we have not made physical barriers for them to access these things, then again, the accidents happen. And once they cross the age of 5 to 6, they start spending a lot of time outside the homes, in the schools, on the roads, in the buses and autos which they travel to school for. And then in that age group, again, it's a very different kind of risk factors that we see. The teachers need to be more aware now, and the school authorities need to be more aware now. So drivers and helpers need to be trained what to do when the bus stops, for picking up children, after dropping children. We always tell parents to pick up their children from the buses, hold their hands, come onto the footpath side, wait till the bus leaves out of the view. The traffic regulations, again, the children need to follow, and they will follow the example set by adults as such. If as a parent, if you are jumping signals, if you are crossing roads without the zebra crossing, children end up doing and trying those things and putting themselves at risk. And once they reach the teenage period, though they are mentally and physically extremely strong, but emotionally they are very labile, and they have a very high appetite for risk. The peer pressure is extreme. So they not only put themselves at risk, but also sometimes innocent bystanders when they take a car out for a ride, or they try to jump, or even the video games like Blue Whale is significantly put innocent children at risk for life as such. So these are problems which we are trying to address using the platform of a book. Now we will go with an online and an offline digital campaign to make people aware about dangers of children putting them at risk and sometimes dying, and sometimes becoming disabled with broken bones, broken legs. And that is one aspect of our medical care. We do not like to treat especially preventable accidents, which can be addressed at the community level, at the school level, at the family level. where we make simple, basic design changes for which we are responsible for. So let me introduce this book called Playful. So this book is written. It's almost around 60 pages. It is primarily written for parents and grandparents and teachers. As such, it starts off in a very conversational style between an experienced mother and a kind of new mother. As such, it has got a lot of pictures in it, and so that means you can actually relate to what we are trying to communicate. The language is very free-flowing, and I would like to thank all the illustrators and all the people who have done the research behind the book and turned it into a book which is easily readable, easily understandable, and very much important to give that protective environment to our children as such in current world. So I'm happy to answer any questions you would like to ask about child safety, or share your experiences about child safety, how there was a near miss, or if there was any serious incidents which you felt could have been handled better and by making some design changes in the house and things like that. So this book is available if you go to the Aster website, Aster CMI Bangalore website. You can order it online. We will deliver it within 10 working days as such. And the thing about this book is all the proceeds of this book goes towards our Aster Sick Kids Foundation, which is a foundation which helps children from underprivileged families to seek complex medical and surgical care. For example, liver transplants, bone marrow transplants, complex pediatric surgeries, or oromaxillofacial surgeries. So we aim to raise funding for that using sales of this book. We are lucky enough, we released it on Children's Day this year, and the response has been very overwhelmingly good. And, thank you for that. So we will put up the link as a reply soon onto the website. Okay, thank you then, and we'll wait for your replies, and thank you again for this opportunity, Facebook, to make this reach a lot of people out there in the community. Thank you.